Cholesterol is the most prominent steroid that we will encounter. This is made in the liver and is found in almost all body tissues. You can see the carbon skeleton of steroid here. We have 3 fused 6-membered rings that's fused to 1 5-membered ring. And the groups that are around the ring will vary with the different types of steroids. This is vital for healthy cell membranes. The synthesis of steroid and vitamin D is important to our biological systems as well. And our sources of cholesterol come from meat, cheese, butter, and eggs. So you can see the structure of cholesterol here. The 3 fused 6-membered rings attached to the 5-membered ring. And we have different R groups coming off of that main skeleton. And there's specific numbering for the skeleton, which you won't be responsible for. But you can see the different amounts of cholesterol that you're going to find in various food items. In 1 boiled egg, you'll see 225 milligrams of cholesterol. And in butter, which is 3.5 ounces, there's 250 milligrams of cholesterol. So this one seemed to me very large amount. So that seemed like a very large amount of cholesterol. So I looked up the conversion. 3.5 ounces of butter is about 7 tablespoons of butter. So unless you're consuming 7 tablespoons of butter, you're probably not going to be having 250 milligrams of cholesterol, at least in one sitting. Whereas if you're having a steak or chicken, you're going to see 60 to 70 milligrams of cholesterol in those things there. Cholesterol is not water or blood soluble, which is why it's not healthy for us because it's going to collect in our fatty tissues. Lipoproteins will transport the cholesterol with phospholipids from the liver to the tissue, which are water soluble. So this kind of acts like soap. And it forms a micelle around that cholesterol. So the cholesterol is embedded in the phospholipid surface with the nonpolar carbon skeleton inside, and then the polar OH groups are sticking outside. It can form cholesterol esters, which can transport the cholesterol to your liver tissue. Low-density lipoproteins, or LDLs, transport cholesterol from the liver to the tissue. If you have an excess of LDLs, that forms a plaque on your artery walls. The high-density lipoproteins will transport cholesterol from the tissues back to the liver, and these have more protein and less cholesterol, and they also transport excess cholesterol to the liver to be converted to other things. High-density lipoproteins will transport cholesterol from the tissues back to the liver, which can then be converted to other things. So this is the bad one. This is the good. So the high-density lipoproteins are made of more protein and less cholesterol. Atherosclerosis is a disease that results from the buildup of the fatty deposit, which restricts blood flow. It also increases blood pressure and increases the likelihood of a heart attack or stroke. So we can see the image of both of these types of proteins here. There's the HDL, which again is the good one. And then we have the LDL, which is bad. And we can see that the HDL is made up of more proteins. You can see the big blobs kind of sticking out there. It can transport the cholesterol to the liver. So we're taking it out of our fatty tissue and bringing it to the liver to be used for other purposes, while the lipoproteins just have one chunk of protein, and that's going to store your excess cholesterol in the tissue, which we don't want. We can see a picture here of an open artery versus a blocked artery. The current recommendations by the National Cholesterol Education Program suggest that we should have less than 200 milligrams per deciliter of cholesterol in our serum. Our HDL should be over 40 milligrams per deciliter, and our LDL should be less than 100 milligrams per deciliter. So we can see how the HDLs can transport from tissue into the liver. LDLs transfer from the liver into the muscle. And we have cholesterol synthesis occurring inside of the liver. You can take statins to reduce cholesterol in your bloodstream, and it is a way to block cholesterol from being made. So some of these statins include Lipitor and also Zocor, which have very different structures. Hormones are molecules that are synthesized in one part of an organism, which then elicits a response at a different site. So you may be familiar with sex hormones or adrenal corticosteroids. Estradiol and esterone are estrogens that are synthesized in the ovaries. They control the development of secondary sex characteristics in females and also regulate the menstrual cycle. Progesterone is a progestin that's also called the pregnancy hormone, and that's responsible for the preparation of the uterus for implantation of a fertilized egg. Testosterone and androsterone are androgens synthesized in the testes. They control the development of secondary sex characteristics in male, including the growth of facial hair, increase in muscle mass, and the deepening of the voice. Some bodybuilders use anabolic steroids to increase their muscle mass, and a long-term or excessive use can cause other health problems, including high blood pressure, liver damage, and cardiovascular disease. Anabolic steroids promote muscle growth. They were first created to help individuals that had atrophied muscles after surgery, and now it's used by athletes and bodybuilders. As we mentioned in the last slide, physical and psychological problems result from prolonged use. So these are a couple of types of anabolic steroids that can be used, including stanozolol, nandrolone, tetrahydrostrionone. These have the same effects as testosterone, but are more stable, and they're not metabolized as quickly as designer steroid THG, which was used by Marion Jones, and that was undetected initially. And you can see in these different functional groups, the core structure is the same of those 3 6-membered rings that are fused to the 5-membered ring. They just change functional groups around there. So as long as the libraries of compounds don't have that specific one, you can change a functional group to something that hasn't been made before and use it as a steroid that will be undetected, just like with the case of Marion Jones and other athletes. Anabolic corticosteroids are synthesized in the outer layer of the adrenal gland, which sit on top of your kidneys. Aldosterone regulates blood pressure through control of sodium and potassium ions. And then cortisone and cortisol are anti-inflammatory agents that regulate carbohydrate metabolism. These types of drugs will suppress organ rejection after transplants, and they can also be used to treat allergies and autoimmune disorders. However, too much use of them can lead to bone loss or high blood pressure. We can also see prednisone here, which is a synthetic steroid that can be used similarly to cortisol and cortisone. We have different fat-soluble vitamins which have similar structures to steroids. Vitamins are organic compounds that are needed in very small amounts for normal metabolism. These can be water-soluble or fat-soluble. So if they're fat-soluble, they'll go into our lipids. Some of these include vitamin A. We can get that from eating liver or kidney, oily fish, dairy products, eggs, different cereals. The recommended daily intake for men is 900 micrograms and it's 700 for women. Vitamin D comes from milk and breakfast cereals. There's a small amount that we need there. Vitamin E comes from different oils and leafy greens, nuts, and beans. And vitamin K comes from cauliflower, soybeans, broccoli, and leafy greens, as well as green tea. So there's different amounts. You can see how much we need there. Our source for vitamin A, which is shown here, is cheese and dairy. This can also be synthesized from beta carotene, so if you eat enough carrots, your body can convert the beta carotene into vitamin A, and that's also converted to 11-cis-retinal, which is a light-sensitive compound for vision in vertebrates. The deficiency in vitamin A can cause night blindness, dry eyes, and also skin problems. All right, this structure here is vitamin D, and these are synthesized from cholesterol. It regulates calcium and phosphorus in your body, and a deficiency in vitamin D can cause rickets and different bone diseases, including knock knees, spinal curvature, and skeletal deformities. This is the structure of vitamin E, which we can get from nuts. It's an antioxidant that protects unsaturated side chains in fatty acids from unwanted oxidation. Deficiency in vitamin E, which is pretty rare, can cause neurological problems. And the structure down here is vitamin K. Vitamin K regulates the synthesis of prothrombin, which is needed for clotting, and deficiency in this leads to excessive or fatal bleeding. So if you look at the properties of both of these, they're very nonpolar because of all the carbon and hydrogen bonds, and so they are not water soluble but are tissue soluble. Eicosanoids are biologically active compounds that have 20 carbon atoms. So eicosane is a 20 carbon chain. So these fatty acids that have 20 carbons are called eicosanoids. They are derived from arachidonic acid. You can see arachidonic acid, which has 4 cis double bonds, and from that can be made PGF2 alpha, which is a prostaglandin. And then we also have LTC4, which is a leukotriene. And we'll talk about those in the next couple slides. A prostaglandin is responsible for inflammation. This decreases gastric secretion. It inhibits blood platelet aggregation. This can stimulate uterine contractions and also relax the smooth muscle of the uterus. So we have 2 different drugs here, PGF2 alpha and PGE1. You can also see the 2 below, the dinoprostone and misoprostol. The dinoprostone can be used to relax muscles when labor is induced. And then misoprostol prevents gastric ulcers. So prostaglandins are what are responsible for inflammation. Aspirin and ibuprofen will relieve the pain and decrease inflammation because they block the synthesis of these prostaglandins by inhibiting the cyclooxygenase enzyme that's needed for their synthesis. It's been discovered that 2 different cyclooxygenase enzymes called COX-1 and COX-2 are responsible for the prostaglandin synthesis. COX-1 is involved with the usual production of prostaglandins, but COX-2 is responsible for the synthesis of additional prostaglandins in inflammatory diseases like arthritis. Aspirin and ibuprofen can inactivate both of those enzymes. This can make an individual more susceptible to ulcer formation. These COX-2 enzyme inhibitors were initially used because they did not increase gastric secretions, but were found later to have worse effects. We have anti-inflammatory drugs that block only the COX-2 enzyme, and this is a treatment for arthritis. So the drug that has the trade name of Vioxx, we have Bextra and Celebrex. These are all COX-2 inhibitors. These increased risk of heart attack and stroke and are no longer on the market. So asthma affects millions of Americans. It involves episodic constriction of small airways. If you use a bronchodilator like albuterol, this can treat symptoms by widening the airways. The leukotrienes are molecules that contribute to the asthma response by constricting smooth muscles, especially in the lungs. Leukotrienes, such as the one shown here, the LTC4, can be made in many steps from arachidonic acid. So the first step involves an oxidation reaction using the enzyme lipoxygenase, and new asthma drugs will block the synthesis of the leukotriene from arachidonic acid. So one of these drugs is Xyluton, or Zyflo-CR. This inhibits the lipoxygenase enzyme needed in the first step by blocking the synthesis of leukotriene, which is responsible for the disease. Xyluton treats the cause of asthma, not just its symptoms.